I've joined what I think is now a revolution in cancer work, that for the first time ever in history, we can now eliminate a cancer. We use something called thermocoagulation. In the old days, it was cryotherapy, but now we can take a little briefcase that has a very small device that is called thermocoagulation. And if a patient turns out to be positive and then under inspection is noted to have early cancer, we can treat that patient in 20 seconds.
From Rotary Magazine, this is the Rotary Voices podcast. I'm Niala Boodhoo. Every minute and a half, a woman dies from cervical cancer. It's the fourth most common cancer in women globally, but it's also a cancer that's highly preventable, and a 15-minute treatment could save lives. That's Rotarian, surgical oncologist, and author Dr. Richard Godfrey talking about one of the many procedures he's done all over the world. His international work has taken him from Nepal to Nicaragua, Guatemala, Kenya, and more. His forthcoming book, Medical Moonshots: Winning the Cancer War, talks about his life-saving work helping communities combat cervical cancer. He also offers some practical advice about assessing your own risk for cancer. The Rotary Foundation has awarded 150 global grants, totaling more than $12.4 million to fund cervical cancer projects since 2014. I recently sat down with Dr. Godfrey to discuss cervical cancer, his career, and his journey to Rotary. Dr. Richard Godfrey, welcome to Rotary Voices.
Well, thank you very much. It's exciting for me to be here. I've read and heard a lot about you, Niala, so I'm very honored to have this opportunity.
I'm grateful that we get a chance to talk about your career and also your work with cervical cancer, and particularly how Rotarians around the world have been involved with this. But I thought we could start at the beginning. Can you just tell us what led you to surgical oncology to begin with?
At some point in our family experience, have had somebody who's suffered a difficult cancer, so that certainly moved me into the field of medicine. I was an inspiring writer and sort of blue-collar jack of all trades, master of none, but then I started medical school late. I wanted to do family practice, but I was encouraged to go into surgery, so I ended up doing a fellowship in surgical oncology, and that's what I've been doing for a long time. I'm retired now, but I'm really excited that I had an opportunity to pursue this new direction, and hopefully I'll be able to tell you a lot more about that.
Yeah, I'm looking forward to talking about that. Can you tell me how you first got involved with Rotary?
Oh gosh, I had a patient that I was taking care of, did multiple operations on him, and every time I would see him, he said, "You've got to come to a meeting." I'm in the Niles Rotary Club. Like many Rotarians, it ended up being a life-changing experience. I had a dynamic club. Richard King was one of our presidents who did a lot of international work. So when I first joined, I said, I want this club to help me to do work in Africa. I have a lot of projects in Kenya. And it turned out we were able to fund probably the only orthopedic surgeon in Western Kenya and get him through his residency training. So I was impressed with that. And I thought, wow, my club loves to do community work, but they also like international work. So I became the international chair. We made trips to Kenya. And from there, one thing led to the next. And I'll talk a little bit about, the field of working in cervical cancer. But I could never have dreamed how many things would happen within the world of Rotary to pursue something that has never really been done in the history of medicine, and that is the potential to eliminate a cancer on the whole planet.
I was going to ask how your work with Rotary changed your perspective on your medical career.
I've joined what I think is now a revolution in cancer work, that for the first time ever in history, we can now eliminate a cancer. And Rotary's given me a pathway to do that, which is, for me, I've never felt so much purpose and being part of such a larger group. Just to give you a rough idea, there are 150 global grants right now through Rotary that are working in the area of cervical cancer and screening and vaccination. We just did a scale-up program in Egypt for $2 million. And I think we're just at the beginning of all this, but I'm part of this extraordinary group of Rotarians from all over the world that are now realizing we can do this.
It's remarkable to think that there could be an end to one type of cancer. So let's talk about cervical cancer. First, what do you want people to know about the causes of cervical cancer?
Well, it's caused essentially by a virus, a HPV virus. Some people call it the papilloma virus. And, we thought at one time in early medicine that maybe all cancers were caused by viruses. That's not true. But this is one cancer that we clearly identify as being associated with the HPV virus, the human papilloma virus. And because of that, we have we have a capacity through vaccination and screening now to eliminate it. And I'm talking about 660,000 women globally that are getting this cancer. It's the fourth most common cause of women's death in the world. And around 360,000 are dying of this cancer. It's a horrendous, horrible cancer to suffer. And I should point out, every 90 seconds, a woman is dying of cervical cancer, and it's entirely preventable. So we've learned this really somewhat recently, come to the knowledge that we have a vaccine and we have there's a lot of technology going on today. We learned with COVID how quickly technology can advance. So because of that, that same technology now can be used to do screening. So that's what Rotary gives me and others an opportunity to do is we can go into countries where before they've never had any screening. Of course, in the United States, we had the Pap smear. But even now in the United States, the new technology, the DNA HPV testing is more accurate, far more accurate than is the Pap smear. And the beauty of it is if a woman is negative, she can really go for 5 years without having to even go in for an exam or all the discomfort of the Pap smear. And so it's really changed the dynamics of this particular cancer, and it's unique to cervical cancer.
I will say, as a veteran of many pap smears, an
Yeah.
alternative would be great. Can you tell us about that screening? Also, just how that works. And I find it fascinating the work that you're doing, particularly throughout Latin America, where women are given at home screening. Can you tell us a little bit about how that would work too?
In a nutshell, there are about 300 different um, machines that can do this DNA testing. And of those, about 25 are FDA approved. And the particular one that I use is not very expensive. It costs around $13,000. And this particular machine can test 1,000 women in one day. So that's significant because a woman doesn't even have to come to the hospital. The healthcare team can go out to the community. They can ask for women in those communities to just take a brush and do a simple vaginal swab. That goes into a test tube. The test tube goes and it gets worked up in the lab with some reagents. It goes into the machine. And within about an hour, you have the test coming back. And of interest, about 80% of the time, the test will actually be negative, meaning that the woman is good for as much as 5 years. If it's positive, then it's necessary to do more screening. We typically do something called VIA, which is visual examination with acetic acid. And that requires, having a pelvic exam, coming to the hospital, and applying no more than 5% vinegar, which allows you to identify if a woman has the early stages of cancer. And if they do, I have to tell you my favorite statistic always is that you can cure the woman of that early stage of cancer in 20 seconds. It's so incredible, but we have that capacity now. So we go to many of these countries we're now working, and we introduce the testing in a hospital. We train the people. It's called train the trainers. I've worked with a number of nonprofits in that field, and basically, when we do the screening and the testing, we're able to really reach out to large parts of whatever community we go to. So this is just getting started, but it's really taken off, and there's Rotary groups all over the globe right now that are really taking this up.
Can you tell me a story of just where you've like how you've done this and what can you just tell me what countries you've done this in? Maybe pick a country you've gone to and just walk me through how that's worked?
I'd like to talk about Guatemala. I started working in a surgical OR and clinic in Guatemala about 20 years ago. So we decided we got involved with a Rotary Club in Guatemala. It's called the Urbari Club. In Guatemala, they have all the pyramids, so it's a wonderful place for tourism and to visit. And we got involved. We were asked to come by this club to set up this training. So we did. I went with a group of sort of dynamic and energetic ladies called PINK, which is Prevention International Cervical Cancer. And we would go to Belize and visit the beach, and then we'd load up in a van and drive up to Guatemala, and we would do these clinics, and a typical clinic would have as many as 500 patients all coming in to be screened. And so it was always rewarding. It was always hot. We had to, you deal with the climate of Guatemala in the summertime, but we were able to really, I think, take care of a lot of people. So that's kind of where we got started, and that model we are using right now all over different parts of the world. And again, my interest was always in breast cancer, but I got involved. I was asked to join the board of Pink, and so I said, "Well, I'll screen for cervical cancer if you promise to screen for breast cancer." And it's taken a long time for that to come into reality. But right now in Guatemala, I just came back, and we are setting up to do screening with a mobile van where we can screen both for cervical cancer and for breast cancer using ultrasound. It's part of a group called the Mayan Health Alliance, and I'm telling you secondhand now, but I'm really excited because one of my dreams has always been, well, geez, remember in polio when Bill and Melinda Gates came and said, let's help out Rotary and let's get rid of polio. So this Mayan Health Alliance has hooked up with Melinda Gates, and so I think that kind of grant is going to allow this to grow. And I would love to see Guatemala take on cervical cancer throughout the whole country.
It sounds like the screening for cervical cancer obviously is much less invasive and cheaper and easier to replicate than breast cancer.
Oh, absolutely. Basically, you can screen a patient for $6 and give her the results literally in the same day. Um, And again, as we've been talking about, you can also treat that patient. Uh, we use something called thermocoagulation. In the old days, it was cryotherapy, but now we can take a little briefcase that has a very small device that is called thermocoagulation. And if a patient turns out to be positive and then under inspection is noted to have early cancer, we can treat that patient in 20 seconds. So that's really rewarding when you can say, "I think you're gonna be okay now. We need to see you back in about a year or so." But before this, those patients, especially in these countries we're talking about, usually they were never diagnosed until they had advanced cancer, and by that time, they were usually incurable. And, these would be women that were the backbone of the family. They were taking care of the children, sometimes the economy. I should say Australia has already pretty much eliminated cervical cancer because they've identified this as a goal.
I'm curious just about, I mean, just the Australian example I think is interesting because is that from vaccines or is that from a combination of vaccines and aggressive screening? How has Australia been able to achieve that? And how are you hoping to do that in other countries?
Important question. And a simple answer is it's both. You have to have both the vaccine for young young people, mostly girls, that are getting treated because of the availability of the vaccine, and that needs to be between ages 9 and 13, theoretically before any sexual activity, which is where this virus in general always is transferred. So if you can give the vaccine before any exposure to HPV, it is like 97% effective to prevent cervical cancer. But that doesn't do anything for the women today, the 660,000 women every year that are getting cervical cancer. So they need screening, and that would be the ages, 30 to 60, that we focus on. It takes the virus upwards of 20 years to actually be present before it will go through the transformation and mutation to become a cancer. So if we can catch that in the earlier stages, which would be women 30 to 60, that then takes care of the other half of the problem. So you need both, really. It's a little bit like if you think about COVID, when we isolated people, well, our goal was to get herd immunity. And I think we want to try to do something similar with cervical cancer.
How close are we to doing that in the US with the vaccine? And what would you like to see in other countries?
The goal of the WHO, the World Health Organization, is to get 90% of people vaccinated, 70% of people screened, and 90% of people who have cervical cancer treated for that. In the United States, because of the pap smear, we have a much lower rate of cervical cancer, but basically the number that's identified by the WHO and in general is 4 women per 100,000. If you can get down to that low level, then you basically are achieving enough control that you can approach the herd immunity that we talked about. You might have heard of Isabel Scarenci. She's in Birmingham, Alabama, and she realized, hey, here we are in the United States. We actually have areas where there's a lot of cervical cancer. So she said, "Let's take that on," and she's been written up by the Wall Street Journal. She gave a great presentation in Calgary at our international convention. But Isabel, I think, is one of the great Rotary leaders right now, and she started locally in Birmingham, Alabama. Then she went to Sri Lanka, and Sri Lanka is almost free of cervical cancer now. And how did she do that? Well, she told us as Rotarians that you have to get all sectors of your country or your community involved. So that means you got to go through the government, the schools, the churches, um, every all the basic leaders of the society have to accept it as doable and worthwhile to do. And she did that in Sri Lanka, and we're on a goal to do that everywhere.
So, Bolivia has the highest rate of cervical cancer in South America. Can you tell me about how your work with Rotary there has gone through what you were just describing in terms of the contact you've had with government officials and other people all working together to try to solve this?
Nyla, you really should come to Bolivia because if you do,
Okay.
you you
Rotary
will
should
s
take
you
I will I'm if Rotary will have me, I will come with you to Bolivia.
we'll definitely invite you, and you'll experience more barbecues and more dancing than you've ever experienced. They're very passionate and emotional country, and they're so much fun to be with. But the long and the short is 5 Rotary clubs, which included Chicago, Seattle, Oakland, San Francisco, and Los Angeles, said, "Hey, we wanna work with this one Rotary group in Bolivia." It's called Urbare Rotary. And then they contacted me and they said, "Hey, would you help us in this project?" And I said, "You bet, I would love to." Well, interestingly, Bolivia is probably one of the hardest countries to introduce this screening and vaccine for a number of reasons. Primarily, the economic situation was very difficult. So I thought, wow, this is going to be hard to do. But we did get a 3-year global grant. I'll be headed there. I've been down there now working for around 3 years, And it involved, setting up the equipment, finding a hospital, getting the right setting, but it's actually going very, very well, and really because of the Rotarians. The Rotary group down there are passionate, and, they go on the radio, they go on TV, they'll let people know. So we're able to do campaigns, bring in a lot of people, and we're expanding now to different parts of Bolivia. We'll be going to Sucre, which is the oldest city in Bolivia. We'll be going to La Paz, the one that's, high up in the mountains, around 13,000 feet. And I see Rotary getting involved in all over that country now. So we'll see how that goes, but it seems to be going the right way.
Can you tell me a little bit more about your current work in Africa, and particularly when we think about cervical cancer, some of the impact that that's having throughout different countries and the work particularly that Rotarians are doing to try to prevent this?
Let me tell you, Nyla, about Kenya. And I first went there in 2006 to join a group of people to provide surgery and healthcare there. But we went with this group called Pink. And when we started in 2006, literally the camps would be flooded by more than 1,000 patients that had never had any health care. And in the hospital where we did surgery, we saw very, very advanced cancers that we would do surgery on. Um, but I was struck most one day. I was outside the hospital and I saw a young woman who was bent over in pain. She was with her husband, and her husband walked over and said, "Are you a doctor?" I had a coat on, so of course it looked like I was. And I said, "Sure." And he says, "Well, my wife has this pain that's uncontrollable, and she's 28 years old, and we have 5 children, and we don't know what to do." And I realized at that time there was really only one thing that could be offered, which would be hospice care and morphine. So we felt like we should do more in that part of Kenya. We built a hospital. 2 years ago, I went to that hospital and we set up this training that we've been talking about with a machine that can do DNA HPV training. So now we can treat women that come in, as I mentioned, in 20 seconds with the thermocoagulation. So it's incredibly wonderful to be able to do that. Africa has so many countries that if anything, have worse problems with cervical cancer even than Kenya. There's a woman named Barbara in Zimbabwe who's a Rotarian. She's the head of a Rotary club. And she was diagnosed at age 30. She had had a negative pap smear and thought everything was fine, but she decided to have another one while she was in the hospital and was found to be positive. And the long and the short is this woman went through 14 operations. And after 14 operations, eventually she was led to a hysterectomy. Her husband wouldn't let her have a hysterectomy because then she couldn't have children. But she was finally treated. By that time, she lost half of her bladder. She had an ostomy. And she's now gone on to form a nonprofit group called Teal. And she offers women throughout Zimbabwe a chance to be diagnosed and screened and diagnosed and treated before they get advanced cancer. So Barbara, to me, is an example of a woman that never gives up and is just, how could you be a better Rotarian? She inspires me to do the work we do throughout Africa.
Can you tell me more about what kind of camps you're talking about?
Sure. Western Kenya, when we first started in 2006, had very little availability except in the town of Kisumu, which is near Lake Victoria. So that's where we started our work. And some of the folks in those groups that were doctors, a friend of mine who is an oncologist named Gail Wagner said, "Well, we can't just keep coming and doing these camps. You need a hospital." So with a very dynamic fellow who came out of the Kibera slums and spent all his honeymoon dowry to provide help to people in the Kibera slums, said, "Well, come to my village and help me to build a hospital." And that all started around 2006. By 2012, we built a hospital. It's now a state-of-the-art hospital. And Rotary has done many of the projects to make that hospital successful. We took out a 40-foot container and $100,000 of medical supplies. And as I mentioned, I go out there now every year to work in this clinic. I didn't do surgery anymore. Now I work in the laboratory doing pipetting.
Because HPV is a sexually transmitted disease, does that pose cultural barriers? Are there difficult conversations people don't want to have around cervical cancer screening? What has been your experience?
Depending on which country, including the United States, there's a lot of vaccine hesitancy here in the United States. One of the big areas actually was Japan. Interestingly, Japan had made a lot of progress with vaccination, and then the folks that don't trust the vaccine, who feel like, well, maybe it's going to create promiscuous behavior. They went on social media, and on social media, they basically almost stopped all the vaccination going on in Japan. When the government realized that, they said, wow, we better do something to have people understand better the science. And, the studies that have been done to look at the impact of the vaccine, in fact, show that it does not cause promiscuity. It just prevents people from ever experiencing a horrible cancer in their lifetime. So that Japan came back with good social media, and they're back on board, and the vaccination's working well. Countries like Bolivia and Guatemala, um, some of it is really the cost. Who can afford the vaccine? The vaccine here in the United States can cost easily more than $100. So we work with organizations like Gavi that can bring that price down to $4 or $5, and I think that price will continue to go lower. So there's the issues of cost, there's the issues of who's going to give the vaccine, and then there's the issue of, do people trust it? So if you go into a Mayan community, they're not used to all these vaccines. They're not sure what you're up and about to. That's also true in Kenya and other countries. But I think that's where Rotary has an important role. Think about how we've worked with polio. There was a lot of mistrust regarding polio, and to reach within a culture really requires understanding the culture, and it requires working with the outreach communities so that they do the work. Now I can go down to Bolivia or Guatemala and use my less than perfect Spanish, but that will never be the same as if a midwife who speaks all the Mayan dialects is going to be able to communicate with the people in those villages and those areas.
At the beginning of this conversation, we were talking about the evolution of healthcare and medicine, and we started talking about the incredible advances we've seen in for immunotherapy. But I wanted to also ask you about AI. As you see genetic testing, AI, all of this advancing, particularly when it comes to cervical cancer, what are your hopes for how this will help? Um, Maybe, as you're saying, this is a preventable cancer that could be eradicated. How do you see AI, further scientific advances playing a role in this?
I think in many ways in medicine in America, we still have to go back to the basics. AI is incredibly powerful. It's going to change a lot of our social approach to medicine and other areas. But at the same time, imagine if you're a doctor or the patient and you have to make a communication that you've just been diagnosed with a cancer. I can't imagine AI being able to do that in the same way that a real physician can. Now, to answer your question, at the same time, it can also allow, through this new technology, and the technology, by the way, is evolving very quickly. Think back with COVID, where we started off, you had to go to the hospital, get tested, and go home, wait for a couple of days, and they did that, difficult swab routine through your
I
nose.
I actually
Um,
described it as like a pap smear for your nose, just so you know.
yeah, yeah. And then within, less than 2 years, you could go to your local pharmacy, Walgreens or CVS, and buy a kit, take it home, and know the results in 15 minutes. That's how quick that technology advanced with that particular virus. So the same is happening with the HPV virus. I think that we will have even better ways. In fact, the company that I've been working with is designing a small handheld device where you can go anywhere in the world and get the results in 15 minutes and say, guess what? You're free of disease, or we need to get you in to go through an exam. So that's an example of technology. But I also want to point out that in the larger scheme of things, like in the United States, we need primary care for people to know that it's important to have the test done in the first place. And that's prevention. That's called that's level 3 or primary care approach to medicine, which is different from the actual treatment where we use. I mentioned the thermocoagulation, or even more expensive and difficult is when someone has aggressive advanced cervical cancer. Now you have to go to the hospital, you need surgery, radiation, chemotherapy, very, very expensive to do, devastating to the family, and imagine how devastating for people that don't have health insurance. So I think we've got to find affordable medicine in the United States, and one of the ways to do that is through primary care and also just education. So that's something I'm so pleased to be able to talk with you now about things that I think all Rotarians should know about. My field is not just, really, I never was a gynecologist and I didn't work in cervical cancer. I work with many other types, but I see how important it is for each of us to understand the immune system, to know what we can do personally. And that's all primary care. That's not AI. That's what we know as individuals within our lifetime. Well, what are our risk factors? What are we doing wrong, or what can we do better? What should we eat? All those factors that come into that field.
I wanna ask you about that, but first I just wanna ask, why is that why is that screening test that you've been describing not more widely available in the US? Why are so many women still doing pap smears?
Well, it is now becoming widely available. Any new, if you think about all the new technologies in medicine, they don't happen overnight. They take years to get introduced. So now most hospitals that I know of in California do offer the DNA test, and they offer both the pap smear and DNA test. So it doesn't happen overnight. It takes several years to make that transition of a way that you've provided medicine.
I do wanna go back, though, to your broader point, in your background in oncology. First, I just wanna ask, as so many Americans are doing genetic testing, so many things are much more available for people. How do you think people should be thinking about preventative things that they should be doing for cancer? Do you think that genetic testing is actually something that helps people, or like in the sense of living a healthier lifestyle? I'm just curious your thoughts on that.
I do think so, although I haven't really done it myself, but I can tell you that many different parts of cancer work, for example, breast cancer, we use genetic testing. And within each of us as individuals, particularly with the evolution of AI, we're going to have the ability to, I mean, now that we can see the whole human genome, we can take individual genomes, and with AI, we can literally, tell people what their risk factors may be. So I think that's going to be very, very important. Um, how do you make that available, and who should you make it available to? Um, I like that quotation from Einstein, who he once said, "Science without religion is lame. But religion without science is blind." You need both. You really need a social approach that offers these new technologies in an affordable way to everyone. So I think we're in this it's a new frontier. We're entering into it. Um, Coming back to your early question, there are a lot of books that are coming out now, and you see every day in newspapers and articles about how to be healthy. And some people simplify it. It's not that hard. There's 5 things. You need exercise, you need diet, you need good sleep, you need good mental health. That's where Rotary comes in because we know within Rotary you have great friendships and that promotes your mental health. And we need pharmacy. We need a lot of us do need to be on medications. As you know, I mean, speaking of technology, we're in this now GLP-1 new drugs, Wegovy and many of the others that are going to take on this issue of 40% of America has obesity, and what are we going to do because obesity leads to all these other chronic diseases. So we'll see how that impacts and who has the availability of the new drugs.
You are actually have written books, including everything a book about Watergate, as well as newer hobby of yours, which is around beekeeping. Where do you find the time to write all of these books? And you have it seems like lots of different interests.
Oh, I didn't really start medical school till I was 30, so I wrote a couple of novels. And then, we talked a little bit about Africa. I got involved in beekeeping there. We have a Rotary project where we work with a very interesting hunting foraging tribe known as the Ogiek tribe. But I wanted to write about the bees. Well, actually, I wanted to write about some extraordinary women within Africa. So the book's called African Queen, Tales of Motherhood and Wild Bees. And in the process of writing the book, I met the grandmother of Barack Obama, and his grandmother lived near where our hospital was. So she asked me to take down some bees that were high up in a mango tree, and that took 6 years. So this book is partly the story of those bees, but it's also about extraordinary women such as Mama Sarah and Wangari Maathai, who got the Nobel Prize for Environment in Kenya. She planted 10 million trees in Africa. So that's a nonfiction book. The fiction stories are about ambulances in Washington, D.C., so you might find them interesting. I started off my career as an ambulance driver after I left the Peace Corps, and that's how I got in. Really, that's how I got into medicine.
With Medical Moonshots, what prompted this book? Can you tell us more about that?
Sure. When I retired as an active surgical oncologist, I kept all the records from so many patients that I took care of that had advanced melanoma, and many of them were some of my closest friends, people that I really came to love. And so when I went back and looked at the research that I did and the friendships that I developed, I thought I have to tell these stories. So I started writing the stories of many of these people that I knew. And in doing that, I then sort of moved beyond melanoma to the 4 other areas that I thought were very preventable or treatable or important cancers to understand. So I went into, as you know, cervical cancer. Prostate cancer is a fascinating, fascinating area. And melanoma sort of helped me to realize, oh my gosh, I probably have prostate cancer, as do most men. 40% do, and they never know it. But it's the immune system that controls it. So I went on to write, I knew many doctors that had breast cancer, so I wrote their stories. And I wrote about colorectal cancer. So those were the 5 areas that I wanted to tell the stories of patients that I knew. And for me, they were powerful stories. So thank you for asking that question.
You talk about in that this sort of the idea of a home squared solution where people look at their own habits and risk patterns. How would you advise people to go about doing that?
Obviously, it's important if you have a family history, but more so through all the habits you develop in living on this planet. And all of us, I think, have habits. You look at the ones that really could be harmful. In my case, I grew up in a family that did a lot of drinking. We did a lot of smoking back in those days. I'm a baby boomer, so everybody smoked back in those days. Um, there are so many other things you can look at, and, going back to those 5, critical areas that I mentioned, you look back at your habits. Do you sleep well? Do you work too much? Is your life too stressful? What can you do? And so Home Squared, it's a concept that actually comes from Kenya, where people often live in Nairobi, but they still have their home village where they came from. And so they go back and they visit with their older family, and they visit where they grew up and when they lived in a country or a type environment where they had to do a lot of hard work and agriculture. And they think back, well, what did I do back then that made me healthy versus what do I do now? Living in the big city, having a stressful life, maybe not doing all of the things that I could to be as healthy as when I was living in that old home squared. So I think all of us have a home squared, which is going back to your childhood and habits that you developed. And some of those habits are good and some can be bad. So I think what I really emphasize for myself is that even though some people feel that healthcare and health should be a right, it's also a responsibility. And and knowing your own immune system is your responsibility. Nobody can know it as well as you do. So I encourage that as one way that we really can win this war with cancer. I really think we can. We'll be able to do it with cervical cancer and hopefully with time. And remember going back to Richard Nixon and then President Biden, we identified this war on cancer. But it's really more than just a war. It's a quest. It's a quest for a healthy society and to be healthy ourselves.
Dr. Richard Godfrey, thank you so much for taking the time to speak with us. I appreciate it.
I want to say thank you for this opportunity.